Okay, wonderful. So welcome everyone to this Alumni Connect Zoom. We are excited. I am personally excited to have Dr. Alex Kentsis here with us today, who is a colleague and a friend and a graduate of our MD PhD program from 2006. And he is Associate Professor of Pediatrics, Pharmacology, Physiology, and Biophysics at Weill Medical College of Cornell. And has a huge and impressive CV that we will hear about, hopefully, maybe not all of it, but the highlights and the stories behind it. He received his bachelor's in biological sciences in biochemistry from the University of Chicago, then did his MD PhD at Mount Sinai, and then completed his clinical training in pediatrics at Boston Children's with a subspecialty in pediatric hematology oncology at Dana-Farber. And he's been on faculty at Memorial Sloan Kettering since 2013 and has been recognized with tons of important field awards, including as a member of the American Society of Clinical Investigation, the Rita Allen Foundation Scholar Award, an Investigator Award from the Society for Pediatric Research, and the Terry Ann Krulwich Alumni Award from Mount Sinai, which recognizes extraordinary achievements in a physician scientist. So we are super proud of Alex's accomplishments and very happy to have him with us today. As I mentioned, we're hoping that this session will be interactive. So I thought we could start by briefly saying who we are in the audience. And then we will hand it over to Alex to give us a little bit of an overview of his perspective. So maybe we could start with brief introductions. If anybody wants to go first, or I could call on you, whatever we prefer.
I can start.
Oh, Cheryl, amazing.
Go for it.
Thank you. Wonderful. Jason, you're off the hook.
Hi, everyone. My name is Gerald Catlett. I'm a third-year MD PhD student, so I'm just starting in the lab. Yeah, that's all I got. Excited to be here. Thanks for coming, Dr. Kentsis.
Great. Excellent. You want to popcorn to somebody?
Popcorn to Lior.
Hi, everyone. My name is Lior Lavin. I'm a third-year medical student interested in immunology and just like clinical research in general.
Excellent. Do you want to popcorn? If not, I can just call on people.
Yes. So Shrutza.
Hi, everyone. I'm Sushrutha. I'm a second-year medical student here at Mount Sinai, and I have an interest in both immunology and oncology. And I will popcorn to Ayman.
My name is Ayman. I'm also a second year. I have just a broad interest in oncology, and I'm going to be taking a scholarly year with the Portal program for an MSCR. Oh, and I will popcorn to Gabriella.
Hi, my name is Gabriella Shapitz. I recently started my first year at the MD program at Sinai, and I'm also interested in immunology and oncology. Oh, and I'm going to popcorn it to Emily.
Hi, I'm Emily. I'm a first-year genetic counseling student. I'm from Pittsburgh, and I will popcorn to Alexandra.
Hello, I'm a fourth-year med student here, currently in the process of applying into med peds and peds, and I actually just finished my research year with the Portal program, getting the master's in clinical research, and I spent the year with the hemonc team, and so I'm really hoping to match into med peds or peds and pursue peds hemonc, so very excited to listen in today.
Great.
Sorry, I forgot to do popcorn.
That's okay.
I muted myself by accident. I will go for Lewis. Making sure I haven't called anyone who's already said something.
Hi, my name is Lewis. I'm on the Alumni Relations team. I'll pass it on to Jason.
Hi, good afternoon. Jason Soto, and I work with Lewis on the Alumni Relations team. Dr. Kentsis, welcome, and I'm happy to be here.
Great. And is it Leishan?
Yeah,
Did I say
Leishan.
that?
Yeah. Yeah. So I'm first in the MPH program actually, and so kind of new to Mount Sinai, and so yeah. So for me, I'm seeing a lot of MD people here, and there are also people on the MD PhD track. So I'm just curious, like why some people will be going for MD only, or some people PhD only, but some people opt for both, and how that affect their career in the long run. So
Amazing. Well, thanks everyone for the introductions. And I forgot to introduce myself. So I'm Talia Swartz. I'm the director of the MD PhD program and an alum as well. So I am very excited. I'm going to pass it over to Dr. Kentsis. And just to say that we have such a great audience here of all different people that sort of have pieces of your intersecting identities. So I think this will be a robust discussion for which I am excited. So if you want to take it from there.
Hello, just call me Alex. Thank you. Thank you for all the kind words and thank you for inviting me. I mean, you should just tell me what you want to hear specifically or in generalities, and I could tell you more. So why don't you, one of you should start at the top, or Talia can guide us along.
Maybe if you want to give us some broad strokes about your story, sort of your narrative. You heard a little bit about inquiries about how you made your choices to pursue this dual degree and where it's gotten you.
Oh, got it. Well, my history is that I was interested in science for a long time, since high school. And when I got to college, I, of course, continued those interests. I didn't really think about medicine until midway through college, when I, just by chance with a friend of mine, decided to volunteer at a children's hospital in Chicago. This was in Chicago. This was a chronic rehabilitation hospital, and they were looking for volunteers to help play with kids on the burn unit. So I spent a few months there, and I found it very satisfying, and very satisfying from just the human interaction perspective, but also because all these kids had really, really severe, life-threatening experiences. I also found it very kind of serious, and I thought that that would be, a very satisfying thing to do, to help to deal with serious illnesses. And MD PhD program for me was a natural one, because I really wasn't willing to give up one or the other. And also I felt, I mean, there was a certain element of, as an overachiever and as a kind of a curious, hungry young person, I felt that the additional years and the additional work actually wouldn't be that burdensome. I didn't really see it as a burden. So it all felt kind of very natural to me. For my PhD research, I wanted to continue to build on my prior interests in physics and kind of theoretical sciences, if you will, but in a more biologically relevant way. So I sought out a mentor who I thought would allow me to combine this, and it was Kathy Borden, who had since moved from Sinai to Montreal. But with her, I studied cellular biophysics and mechanisms of protein self-assembly in viral infections, and a little bit in cancer. And then, having gone through clerkships, I was looking, of course, for a field of medicine. And it was very clear early on for me that while, of course, I enjoyed lots of areas of medicine, I found medicine, internal medicine, to be less satisfying than pediatrics, in part because I enjoy dealing with kids, in part because as you know, a lot of internal medicine is really complex, multi-morbidity, geriatric medicine, and I felt that I would do better with simpler diseases and simpler presentations, and so that was the choice of pediatrics, and it was further strengthened by the fact that in pediatric hematology oncology, which was attractive to me through the intersection of cancer biology and pediatrics, there has been a long-standing history of physician scientists, many very productive physician scientists, and a career that was clearly laid out with training programs, and kind of a field that was seeking trainees, and where I wouldn't have to struggle with getting training to become a physician scientist. There's certain fields of medicine where it's still quite challenging because there isn't much of a track record. There are relatively few physician scientists. And so that brought me to pediatrics and pediatric oncology. And then for my postdoctoral training, I again wanted to find a mentor who would appreciate the kinds of thinking I like to do from a physical perspective, but who actually would teach me certain things that I didn't really have formal training in, namely genetics, because I felt that to be really effective as a scientist and as a vision scientist, I really needed to know genetics and use genetics. And so that's why I sought out. It was Tom Look, who is a cancer biologist who spent a lot of his career doing genetics and genomics and functional genetics. And so I studied with him, and then in looking for faculty positions, I actually considered a position at Sinai with Lisa Sadlin, but ultimately settled on Sloan Kettering because of a more robust support structure. We could talk about that may be beyond the scope of your thinking, in the years that are in front of you, and also because the institution is really interested in innovation, and kind of I thought it to be less risk averse than many other places, and so that brought me to Sloan Kettering, where I've remained. So that's the gist of it.
Well, thank you. That's great. And I have a bunch of questions, but I would love to hear from the group if anybody wants to jump in before.
Yeah, I have a question for you, Dr. Kentsis. I, especially as an MD PhD student myself, interested in doing pediatric oncology, I feel like your career path is one that I very much look up to. I came from doing research at the Dana-Farber prior to coming here in the PET-Onc department. Loved Boston, would love to go back for my clinical training. And upon coming here, now I'm doing my PhD in cancer pharmacology. And so something that I've been wondering now that I'm starting PhD is trying to figure out the best way to balance clinical opportunities. And I wanted to know, what ways did you, during the pursuit of your degree, pursue clinical opportunities, whether it's shadowing or research that either contributed to this kind of to your interest in the hem-onc space, or your toward obtaining a residency at Children's in that space?
Yeah, I mean, I would look at it. I mean, you're right, of course, to think strategically and develop your career with kind of long-term goals in mind. But I would say the best part about PhD training and the most important part of it about PhD training is to learn how to think like a scientist and to become a scientist in your own right. The clinical practice and clinical exposure and clinical training will come in time. There's plenty of time during the rest of the program to do that. So I would say the only reason to pursue patient-related activities during the PhD is if it's really calling you and you just need at this time to have this kind of satisfaction and these kinds of interactions. And there are many reasons why one may have those needs. And if you do, then definitely pursue them. But if it's for strategic reasons, like you seem to suggest, I would not think it's that important because again, there are many other opportunities during MD PhD training to explore your clinical interests and to show your commitment to patient care and your humanism and your clinical acumen and so on and so forth. So I'm trying to, as you were asking me, I was trying to think back what I did what I did during my PhD years that was patient facing, and I can't really recall outside of the curriculum, the activities of the curriculum that maintain the continuity during the PhD years. I don't think I did anything else. But you may have a different feeling.
Thanks so much. That was a great answer. It's definitely, I think, especially going through the first 2 years of med school, it's interesting to see how proactive people are being toward going for their kind of, oh, this is what I'm interested in, so I want to do this opportunity now. And obviously it's a shorter runway that a lot of my NB colleagues have to pursue it. And so I think there's some pressure there on my end to try to do that.
And maybe,
earlier. But like you're saying, I think it's worth focusing on the
Yeah, and thinking back, probably the most impactful clinical experience were actually with people whom I saw as role models and mentors. So again, if you have such a person already that you've met, then certainly continue, you'll get much more out of it. But and if you want to form such a relationship, that's also reason enough to do it. So yeah, those are the primary considerations.
Other questions? And while people are thinking, a couple of things. First of all, I was struck by the fact that you talked about your PhD and then you felt that you needed a stronger training in genetics. And I think that's important because we often feel like there's this expectation that we need to learn everything by the time we graduate. So I wondered if you could reflect on sort of how you've had different stages to your learning and that it doesn't end.
Right. Yes. Yes. I mean, I think you're right. I mean, of course, in the more so now than ever, because so much of medicine and science is multidisciplinary, we need to and are expected to have deep understanding of many different areas of science and many different disciplines. But as you said, it's impossible to know everything. It's literally, really is impossible. And so, I mean, I've always had pretty strong interests scientifically. And for those things that I found interesting, I really wanted to master the subject and really become an expert in that particular area. And during the PhD, of course, that's what actually happens, right? In your specific area and field of science, you become an expert that, pretty much, if you do your work well, pretty much you will become at the very cutting edge of that particular discipline, at the very frontier of knowledge for that area. But it's impossible to cover them all. And so, that's what I did in my career development, and that's what lots of people before me did, is that they sought to develop skills and expertise in areas that would then allow them to pursue certain new questions. So that's, this comes back to this kind of strategic thinking that you brought up earlier. That's what you should be thinking about. Even in your PhD, it's not too soon to start to think about what kinds of questions you may want to pursue later on your own. And what kinds of expertise do you need to gain? in that, in that process going forward, where again, the training is multi-step, right?
I just have kind of a simple question, but how would you describe average week for yourself in terms of dividing time between the clinic and the lab? And I don't know, do you find yourself enjoying some parts more than the other, and how do they help each other out and enhance, your clinical skills having worked in the lab, or vice versa?
Yeah. No, definitely. I think there is huge value in doing both, because I think the science improves medicine, and even in I'm not just talking about laboratory or research discoveries that impact the future practice of medicine. I even mean in on a day-to-day basis, where the way I approach patients is in a very scientific way, and I think it makes for better medicine. I think it makes for better teaching of students and trainees and residents and fellows and so on. But also the opposite is also true, where the kinds of problems I study in the lab are very much informed by the needs of patients and the gaps in our knowledge and the inadequate therapies that we have to offer for many patients. And also many discoveries come from patients, where each patient and each disease is really an opportunity to learn something new. And again, with the advances in molecular diagnostics that we all have today, you really can learn now from each patient and discover something new about disease and biology from each patient. So I definitely believe I believe in that value. I also, as I mentioned, it's very satisfying, because science, as you probably have already begun to see, science is a very selfish pursuit. It's about your ideas, your creativity, your interests. I mean, of course, it's collaborative, right? You collaborate and you work together, but that's the primary driver, right? Is this kind of a selfish pursuit? But medicine is just the opposite. Medicine is not about you at all. Medicine is about patients and families. And so I find it actually, paradoxically, very relieving to see patients, because it liberates me from this, self-directed thinking. So maybe that's just my own psychopathology, but that's definitely true. And the final thing I wanted to add about these two things, so to come back to your question about the how does the week look like, or how does the day look like? I'm of course in pediatric oncology, which is a medical specialty, right? So it's not a technical specialty like surgery or anesthesia. And so there are many ways to do that kind of medicine. And on occasion, I'll see patients in clinic on the outpatient basis, but it's generally rare. It's generally by some special request for some special consultation. Most of the time, I see patients only in the hospital when they're hospitalized, when I attend as the pediatric oncology attending for the hospital service, for the hospital floor. And I chose to do that deliberately. I have many colleagues who see patients in clinic, meaning every week there's a day or half a day that they go to clinic and they spend that whole day seeing patients there, and then they go to their lab and so on. So I see patients only in blocks of 1 or 2 weeks, contiguous blocks, but they are spread throughout the year. So I find it a little bit easier to do intensive science, because when I am not on service, I really can dedicate essentially all of my time to science. And so in certain fields of science, it's kind of necessary, because the field is moving fast, and you kind of have to pay attention. It becomes challenging when your attention gets taken away. So I hope that answers your question.
Yeah, thank you so much.
And I guess I would add a little bit to the question about sort of like, what does your day look like? What are your weeks look like? Is how do you sort of plan out your life? How do you decide how you spend your time? And how does that also include things like family and other outside?
Oh, yeah. It's a great question. It's, so I'm at a point in my career where, professionally, I'm kind of established. I don't mean to sound arrogant, but I feel kind of confident in terms of my scientific stature and my clinical stature and my professional kind of stature. But this wasn't the case up until recently. And prior to this, I structured my day and organized my time primarily with the goals of attaining this kind of stability where, to be honest with you, I mean, I still work a lot, but, I spend a lot of time thinking about these questions and doing this kind of work. And maybe less than, in terms of hours per day and hours per week, less than residency and fellowship, but not much less than that. I mean, obviously, I don't sleep in the hospital anymore, but still, a lot of time. And so the balance, the work-life balance that Talia mentioned is a real, it's a real conscious effort where you have to draw boundaries. And I drew boundaries, and I still have them. And I wouldn't work past a certain hour. I wouldn't work at least one day on the weekend. What else did you ask me that I wanted to say? And of course, vacation, family vacations, I would also dedicate, family vacation time. And so I wouldn't, and when I go on vacation, I literally turn everything off, with the exception that of people, I tell people how to reach me in case of an emergency, but I tell them it's really, in case of an emergency. And I'm very serious about it. I just tell them, how to get help without calling me. So I hope that answers your question.
And I guess the follow-up to that is that you mentioned that you're sort of working the hours as you did as a resident and a fellow, and sort of can you take us through like we sort of think of like, this is what I want to do when I grow up, but I think we talk less about the cadence and the sort of the waves of things. So like how has you mentioned you feel like you're in a place now where you can feel confident. What did that look like? And how do you feel like, how did you arrive at where you are now? And do you feel that you have arrived?
Well, maybe I'll start with the last question, which is, I think all of us, every X years, where X maybe is a little bit person dependent, but certainly every X years, certainly where X is a single digit number, feel that we have accomplished a certain goal and now ask, what is the next thing that we want to accomplish? And so now that I feel, like I've achieved certain scientific and professional goals, now actually I've been thinking and asking myself, what is the next thing I want to do? So I think that's definitely true going back. So, in medical school, I wanted to finish my thesis and have a good thesis and finish medical school and figure out a career. And after that, of course, it's also quite prescribed, at least in certain career paths, with residency training and fellowship training. And after that, of course, a faculty position. And the faculty position is also, at least to a certain degree, outlined, where most of the time in tenure track faculty positions, there is a promotion series where the final assessment is tenure or no tenure by your colleagues and institution. And so it's kind of been decided this career path, this career step ladder, or again, I don't want to use metaphors, but this process has kind of been decided from the beginning, right? If you decide to pursue a career in academic medicine, that's the typical process, right? And now I'm at a crossroads of having come to a certain point to decide what is next, right? What is next? And people choose many directions. Some people continue doing exactly what they've been doing, science and medicine. Some people focus on education, administration, right? That Talia is doing. Some people focus on other leadership positions to promote, other aspects of academic medicine. So that's again, it's a little vague, but that's what makes me, that's what comes to mind in response to your question. So ask me more.
Excellent. Other questions?
Yes, I have a question, Dr. Kentsis. I want to hear more about what drew you to oncology. Like if you could have seen yourself in any other specialty coming from pediatrics or not.
Absolutely, right. I think like many people, I have many interests, and I like many different kinds of medicine, and I like interacting with different kinds of patients in different kinds of ways. And what I liked about oncology was, of course, I like the science, right? The practice of oncology is pretty scientific, and I like the science, and I like how I could learn from patients, and how my science could impact patients. So I like that synergy, if you will. But I also like the fact that it was, it's a very, the disease is life-threatening, and not that I want to see patients suffer and die, but I thought that by making an impact, that it would be really satisfying. And also, to be honest, in retrospect now that I've kind of experienced more of it and can think back, it's a bit of an adrenaline-driven field, like critical care, like surgery. And I, have a bit of that, adrenaline pleasure, right? So that's, now looking back, that's, I think, part of the motivation, right? So it kind of feeds back on that, and that satisfaction. And so that brought me to oncology. And again, the other one, the incidental one that I mentioned earlier, was that for physician scientists, I felt, the field is full of physician scientists, pediatric oncology, and oncology in general. And I found it an easy path forward. For example, much more difficult in surgery, right? Surgeon scientists are very, very rare, and many surgical departments don't have that many. Not to mention, of course, that to be a laboratory scientist and a surgeon is challenging from the practical standpoint of having to maintain surgical excellence and being in the operating room X days a week, right? So, but there are many who do that successfully and happily. So that's my oncology story.
That's really helpful. Thank you.
I have a question. So I guess, do you have any advice for someone like me, who is only an MD student but has an interest in going forward in the career, being in academia, maybe trying to get a faculty position? I did 2 years of full-time research at NYU prior to medical school in their cancer center, like bench research, and I really liked it. And I think the thing that draws me to oncology is actually the science behind it and the science behind the treatments. And I just find them like really, really interesting. And as part of my career, I don't think I only want to be a clinician. So do you have any advice for someone who may be coming out with only an MD degree, but who is thinking about going into academia?
Yeah, I think if you enjoy research, that's what you should do. You should continue. There are plenty of scientists of all types, including laboratory scientists, who do not have PhDs. They had medical training, and then they did postdoctoral or predoctoral laboratory research training. Lots and lots of people, many of whom actually, stop practicing medicine and only do science by choice. So I think you should totally go for it. There's really nothing that should hold you back. And of course, you will need, in your training forward, you'll need a mentor, a scientific mentor in a discipline that you're interested in. But again, there are plenty of people who are interested in being such mentors. And so I think, yeah, certainly. And even, now, like, for example, at Sloan Kettering, right, we have lots of postgraduate trainees, residents, and fellows, and lots and lots and lots and lots of MD fellows who are doing research. So, and the same is true across lots of different fields of medicine. So, yeah, I think go for it.
Okay. Thank you. Yeah, that was really helpful. And as a follow-up to that, I was wondering if you think there's like anything that like during medical school, like in terms of like types of research that would be helpful when like going forward and applying to residencies. I know it's like a little bit tough to do a significant amount of like bench research as just an MD student. So I try to do like computational oncology research. But is there anything else that you would advise in preparing for like residencies or like a research residency potentially?
Yeah, I mean, it's the same consideration, right? Obviously, if there's a field of science that you see being integral to your long-term research interest, like you mentioned, computer science, yes, you should definitely do that. But most importantly, it's about working with a mentor, with a scientific mentor, who can really teach you not just skills, but how to think scientifically. So I think, again, to the extent that you can do that during medical school, you should. But sometimes, life doesn't make that easy. And if that's the case, that's okay also, because you'll have an opportunity later on in residency and in fellowship to have such a scientific mentor, and you'll do just as well with that, even without doing research during medical school, right? So,
okay, thank you.
Yeah, and I would just add that I encourage us when we're sort of thinking about research careers or clinical careers to not think of one degree as like only, or that like an MD only or a PhD only. I think it is really important that we, all of us, recognize the importance of each of these paths and degrees, and to not think of it as like I'm missing something. Like each one is extremely important and allows you many different opportunities. And as you heard, there are tons of options to do research as an MD, both through either with an additional degree or not. And we are seeing that the physician scientist workforce, like nationally, is 50% MDs and 50% MD PhDs. And so it's really just a question of how you do the research and when, but not if. It's definitely, there are ample options to get involved at all these different stages. So I think these kinds of conversations are really important to recognize the diversity of options that exist.
I agree completely. I think it's not about accumulating letters after your name. I agree completely. And
I have another follow-up question. I'm just wondering, kind of, if during residency, did it feel like the balance was off, like it was too much clinical work, not enough research, or were there other moments in your career where you felt like it wasn't your optimal balance?
Yeah. I definitely, very shortly after I started residency, in response actually to the actual clinical care, I very quickly sought out a research project. And because I felt, I wanted to continue doing research, I felt that I could do research while in residency. And as I mentioned, it was really driven by my patient experiences. So for example, early on, I admitted a patient with appendicitis. I actually can't remember what kind of appendicitis, whether it was complicated or uncomplicated, but I remember I had a patient with appendicitis, and I was talking to the emergency medicine physician who was admitting this patient. I was the inpatient intern, and we got to talk about appendicitis, and he was actually studying appendicitis, which, believe it or not, while being one of the most common surgical emergencies overall, still remains poorly understood. And so we got to talking about how there really aren't any good diagnostic tests for appendicitis. And so I thought, well, what about using proteomics to identify potential new protein markers of appendicitis? And so that led to a research project that I did during residency. I did it because it was a very clinical translational research project. I could be in the hospital on service, in psychiatry, but still, enroll patients in the emergency department into this study that we developed. And so, yeah, it was great fun. And and lots of my friends did other things, during residency, like that, of all kinds. So I think, yeah, do it.
Excellent.
I have another question. Dr. Kentsis, you said before that one of the things that drew you to oncology was that it was a bit of a adrenaline-driven field. Can you just elaborate on that? Because at least to me, I wouldn't think of oncology as like an adrenaline-driven field like surgery is.
Yeah, it's just like that, actually, to be honest, because many of the presentations when people are diagnosed with cancer often are emergencies, and so that's that's pretty terrifying at first, and then during treatment, because the treatment is so intensive, where the therapies, at least conventional chemotherapies, are really at the maximally tolerated dose that is otherwise lethal. It's really it's also another harrowing experience, even just to treat patients. And of course, sadly, in some cases, when the therapy is ineffective and patients are at end of life, it's a different kind of harrowing experience. So all of that, all of that is, amounts to a pretty stress driven, kind of medicine. And there's a challenge also, besides the challenge, that we just talked about, there's also a very profound challenge for yourself as a physician to be able to care for patients in that extreme degree, so it's and that's why actually some of my colleagues did not continue their training. They left oncology because they could not dissociate themselves as physicians from the experience of their patients. Right? So this is not unique to oncology. This happens in other fields of medicine too. So again, this requires a very, very serious effort to learn how to operate this way, right? So so a kind of a challenge, right? So I enjoyed that also.
Thank you. I have another question. I'm curious how you followed up on each research experience after you were done with that institution. Like, let's say after your thesis or during residency, how much involvement did you have after you left? And was it hard to leave a project that you had invested in? I'm currently encountering this with my college project and starting medical school. How much do I kind
Right.
of keep in touch with that and continue. I'm curious to hear your thoughts.
Right. Yes, I also switched, I kind of switched fields also. Like in college, for example, I studied protein folding. And while I stay in touch with my mentor, I no longer work on protein folding per se, but I do continue to read, and on occasion I will correspond with him about interesting new papers in the field because I like to keep up. The same thing happened in my PhD, where again I studied protein biophysics, and then I've moved on. But you always come back again if you have interest. Again, if your interests are coherent, where there's a theme in your mind, at least, of how your scientific interests are connected, you always come back to similar questions. For example, recently I had a project in my own lab where we used some protein engineering approaches for cancer therapy, and I returned back to ideas that I used to think about during my PhD. So, but it is true that we have to move on. I no longer work on these problems. There's another reason actually that we have to move on, which is for better and for worse, at least for promotion. This is in faculty promotion. For better and for worse, faculty promotions committees evaluate for independence, for scientific independence. And so they will actually look for research directions that are completely new and not dependent on prior mentored work. So that meaning when I, for example, started my own lab, I had to very consciously pivot in an entirely new direction that could never be attributed to my prior mentored work for this reason. Right? So
That's really helpful. Thank you.
Maybe related. Oh, sorry. Do you want to ask?
No. Please go ahead. Oh, and there's somebody else. Yeah.
Oh, I mean, I've asked a bunch of questions already, but
Okay.
I just wanted to know, Dr. Kentsis, if there's any what you think the future of cancer therapies are in like maybe the next 10, 20 years, or if there's anything that's very nascent right now, but you think will grow in the future. I know we've seen like CAR T-cell therapies be very effective for liquid tumors. Do you think they're going to be effective for solid tumors as well in the future?
I mean, it's a big field. Immunotherapy is a big field. It's the field of cancer immunotherapy has gone through, fashion and out of fashion and fashion out of fashion. So cancer immunotherapy is as old as oncology itself. Of course, now it's very much in fashion based on the successes that you mentioned, and it's a big active field. Lots of people working on it, and certainly, I do think there will be lots of new immunotherapies for lots of different tumors, both engineered cell therapies, which is in kind of the field of synthetic biology, as well as engineered macromolecular therapies, kind of, engineered macromolecules, proteins, and so on. So yeah, that's a big, big field. I do think that genetics and somatic genetics is gonna propel not just oncology, but lots of other fields, where increasingly we're recognizing that many diseases that we used to think are sporadic actually are not sporadic. They are diseases of somatic mutagenesis. For example, atherosclerosis, which we used to think was maybe had some inherited basis, but mostly was due to lifestyle factors and exposures. Actually, now it turns out that probably is in majority due to somatic mutations in hematopoietic stem cells that lead to the production of dysfunctional immune cells that lead to vascular inflammation. So anyway, so I think that will make lots of impact in lots of fields, and I think in surgical disciplines and devices, medical devices, I think we'll see lots of new devices based on miniaturization. Yeah, so I think that will come also.
Amazing. I had one question related to you described when your PhD mentor moved to Montreal, what the impact is of that as a trainee, how it impacted you. There are clearly huge differences related to where you are in your training. How do you, when your world suddenly changes, what do you do?
Yeah. Well, she moved towards the end of my PhD. So by and large, my PhD thesis was finished and I did not suffer from losing a mentor, let's say, or having to move in the middle of a PhD, where some students have to do that, where they have to relocate with their mentor. But now in retrospect, I recognize that there were several things that happened due to her move that maybe had an effect on my career, but it's impossible to tell. One of them was that she was looking for new positions for some time. It wasn't instantaneous during my PhD, and we had a manuscript that was reviewed favorably at Science, and I was full steam ahead on doing experiments to revise this manuscript, but she insisted on pulling it from Science and submitting it to PNAS for rapid publication. At the time, there was a way to rapidly publish manuscripts in PNAS, which is what we did. She insisted on it, but I, of course, was very much opposed because I thought this deserved and could have been a science paper. And so it's an interesting question of what would have happened had it been published in Science. Would my career have gone differently? I mean, I can't complain, right? As you heard, I really have no complaints about what happened to me, but these are the things that happen, and you have to accept a certain degree of unpredictability and a certain degree of suboptimal outcomes. Things always happen that are outside of your control. COVID was a huge bummer for many of us. So
Excellent. Well, resilience and growth, lots of lessons learned. I am grateful to you. I hope that our participants learned a lot from this. So let's take a moment to thank you for this really inspiring journey through your experiences. And thank you so much for your time and your insights, and hope that everyone has a wonderful evening and can take some of those nuggets along with them.
yes, thank you so much. Stay in touch. Hope to see you.
Wonderful. Okay. Thanks, everyone. Have a wonderful evening.
Thank you.
Thank you. Thank you.
Thank you so much.